Hello everyone and welcome to Physiotrendz. This is me Physiotrendz and I'm back with the Physioquest series. Yesterday I asked you all one question and the same question we are going to discuss in today's video. Guys, if you all are watching this video for the first time and you are new to the Physioquest series, I recommend that you go back and see the first and second series of Physioquest. You will find so many good questions and explanation with reasoning of the answers. So the information in question goes something like this, that as physio progresses to his or her examination, they finds out that yes, there is something wrong with the ACL in the right side of the knee joint. So the question is, which test would be unnecessary to perform from the given options? And the options given over here are option A, Latchman Test, option B, anterior drawer test, option C, Slocum Test, and option D, pivot shift test. Now out of these four tests, definitely we know that Latchman Test and anterior drawer test are there to confirm ACL injury. So many of you might be thinking that yes, they will be necessary to perform, and that is why you will be choosing last two options like either Slocum test or maybe pivot shift test. And that makes some sense also, but the question is little twisted, which I am going to explain you right now. Now Slocum test is actually a modification of pivot shift test, which we perform on the patient who are overweight and we cannot directly perform pivot shift test. So for them, we'll be performing it in the sideline position with valgus stress applied and flexion in the knee joint. Okay, as well as pivot shift test is mostly performed for meniscus injury and to find out any knee ligament injury in which patient is weight bearing on the affected side and trying to twist the ankle or twist the tibia. Tibial rotation is happening. If pain persists, then we confirm that yes, test is positive. But here the question is about ACL injury. Therapist is already suspecting that ACL injury is present. Now, why we should not, why there is unnecessary to perform Latchman test, or why there is unnecessary to perform anterior drawer test. So Latchman test, as we know, in this test we'll be performing the anterior translation of tibia with hardly 10 to 15 degrees of knee flexion. So it is less dangerous, okay? And the anterior drawer test, because we are performing with maximum knee flexion and then perform anterior translation of the tibia, we might injure more ligament fibers as well. And that is why this would be actually not necessary to perform when you already have an idea that yes, ACL injury is present. So you just confirm with the Latchman test and then you just go ahead without flexing knee joint more, so that we can avoid overstrain over the structures of the ligament, or we can avoid further more injuries in the ligament. And that is the reason, my dear friends, option B, anterior drawer test, is going to be the correct answer, because here in question it is asked which test will be unnecessary. An anterior drawer test will be unnecessary because it is going to cause extra injury to the ligament, to the joint of the patient. I hope you understood this question, and if you have any queries about it, do let me know in the comment section, and also let me know that how do you find this comeback of Physioquest series and what you want me to do more in this Physioquest series. Thank you so much once again, and keep liking, sharing and subscribing my channel Physiotrendz.